Thank you so much. And to our whole panel, it's great if you could all, for the panelists, please turn on your camera. And we have lots of questions, so this is great. And thank you also to the panelists who've answered questions live. I know especially Dr. Prestwood, you've answered a lot of questions too. So for the audience, please do take a look at the ones that are in the answered section to see if they might have addressed your questions. And I'll try to hit on some of those as well. There was a mention about fluvoxamine, which is interesting. Dr. Presswood, if you could speak a little bit more in terms of specific dosing or regimen. I also found it fascinating because there's been some data about it in acute COVID, potentially for just anti-COVID effects, but of course also for mood symptoms as well.
Yeah, no, I think it's really exciting. And it's been shown in a few different studies. So I think there's something real there, which is exciting. In terms of dosing, in general, I've found with long COVID patients, I tend to try to start a little lower than typical doses. But with fluvoxamine, it is recommended that you start at 100 daily and then go up by about 50 a week um, for the daily dose. And so I tend to follow that, and people tolerate it quite well. There's almost never a problem of starting lower than that, though. And then again, in terms of the formulation, the extended release tends to be better tolerated as well.
Great, thank you. And to Dr. Lazarow, thank you so much again about mentioning the mind-body connection, of course, to all our other panelists who built upon that further in the biopsychosocial model and just the context, the complexities of patient symptoms as well as their social context. And a lot of times I'm hearing from people, they're talking about identity crisis. This is not who I am. And some patients have mentioned, framing forward has been really helpful for them instead of always wanting to return back to who they used to be and being fixated on that. How do you approach that? Or what, of course, this could be a whole discipline of itself and your expertise and others, but do you have any tips just for clinicians out there who are seeing patients like this? How can we start that conversation? Of course, refer them to group therapy or to supportive therapy, but what are your tips for that?
Um, that's a great question. I think what I think about in kind of shorter doses of just engaging someone is kind of calling their attention to what it does to them when they go back there, or kind of the tension they're even building up, not just psychologically, but even tension in their body as they kind of almost won't accept what reality is, that something has changed. So I think a lot of times it can be even just calling attention to when you go there, like, how do you feel? Do you notice how that negatively impacts you? Maybe takes away any motivation, and being able to maybe direct them, even if they don't know how to stop doing that, being able to just call attention to it, and then being able to say, there are a lot of people to support you, to help you kind of move to this, being where you are right now, which is why I use a lot of mindfulness with this population of kind of letting go of the past and also not going too far into the future too. Just kind of being here and seeing in what ways you kind of like are okay, or how you can kind of understand your limitations here so that you can push them. Because a lot of times if you're operating as though limitations are where they were, you're kind of setting yourself up for failure. So I think a lot of times it's just kind of calling attention to that. Does that answer the question?
Yeah, great, thank you. And if anybody else wants to add things, please feel free to.
We also talk about that in the cognitive therapy sessions, reframing that this has been a significant event that they're going through or have gone through, and that does change us as human beings. But I try to have them really tap into how resilient they are in overcoming these adversities that have come about from the pandemic in general and COVID, and just reframing that these things do change us. So it's hard to go back to exactly the person that we were several years ago. But most patients, again, find it that we can channel this into empowerment.
Thank you so much. I love that word, empowerment. Yeah. Dr. Grossman, did you also?
Yeah, I was just going to say, I find it helpful to remind patients or ask them about other life phase changes. And they think about that and they say, oh yeah, things never do stay the same. And therefore it gives them maybe a little confidence that they'll come through this as well and things won't be the same, but maybe they'll be even better. So.
Yeah, that's great.
And one thing I'd almost add is just a phrase that I think is helpful is I think a lot of times the idea of acceptance, it's not resignation. And so kind of reminding someone that it's not putting your hands up and never accepting something that'll never change, but it's kind of accepting where you are so that you can shift.
Great. Thank you so much. And for speech therapy, Sarah, do you mind speaking to first, if somebody was asking about the website, if you could link it, that would be great in terms of the resources.
Yes, I had those in my slides that will also be available. But I just wanted to mention, I mentioned in California we have this Department of Rehabilitation that provides a lot of resources. Somebody asked me for that link, and as I'm going to the website during the conference here a few minutes ago, I see that they've structured their website, government website, very differently rather recently, and so it's not going to be obvious like the long COVID. But if you look up by symptom, so whether it's some of the physical things that we've talked about today, cognitive or psychological, that's all tabbed by symptoms. And I can put that link to the California Department of Rehabilitation in the chat.
Thank you. And then there was a question about specifically, are you seeing issues with intermittent aphasia or like what do verbal fluency issues look like for these patients?
Yes, I typed a response to that, but verbal fluency includes our ability to retrieve words. And so, for the most part, these patients are having difficulty with word retrieval, not so much a distinct aphasia, although early in the pandemic, when many people were critically ill with COVID and there was increased incident of stroke or cerebral vascular injury, then we were seeing patients with distinct aphasias. But in the context of long COVID, it's rooted in retrieval or recall of words or names, and more under the cognitive umbrella.
Great, thank you. And for our physical therapy colleagues, thank you so much for your great presentations about management that actually answered one of the questions we had from a prior session about, what to do with post-exertional malaise, which is a huge issue. And actually related to resources, would you, in addition to the amazing resources you provided, there was a question, is there a website or other resources as well for physical therapy and rehab practitioners on extra training for long COVID? Patients have unfortunate experiences with rehab referrals triggering PEM, post-exertional malaise. There seems to be a lack of awareness among practitioners. And what are your tips and guidance for that for others out there?
So I will say there's not anything specific for physical therapy. A great resource that I have had was through the Bateman Horn Center. They have a really great website that just goes through different videos and clinical pearls, I guess, is a great way to say it, as well as patient handouts, which I think is super helpful. But outside of that, there's nothing, unfortunately, that I can direct somebody to. The other piece would be just reaching out to patients or therapists that are already treating patients with myalgic encephalomyelitis, or EDS is another one that there's a lot of connections to long COVID. Those therapists tend to have a much better understanding of all of it. So having that mentorship is really important.
Great. And then there was a question earlier, we had a talk about headaches, and there was a question about manual therapies or physical therapy for tension type headaches or migraines that seems to have a tension component. Can you, either of you, speak to that just in terms of PT for headaches post-COVID?
Yeah, I would say that I very much have used a lot of manual interventions with our patients. A lot of times I'm trying to drive, though, if there's a sensory phenotype, if they're more proprioceptively or somatosensory dependent, then I find that tension is going to persist if we don't try to help them remap their sensory integration for orientation as well. But yeah, it definitely plays hand in hand.
Great. It's very good to know that these can be helpful. Thank you. And then this is going to both Dr. Prestwood and Dr. Grossman. I think actually, Dr. Prestwood, you might have answered one of the questions about psychedelics in the context of your talk, but then also there was another one, Dr. Grossman, about psychedelics in the context of long COVID symptoms in general. I think there's one about mood symptoms, but can both of you or either of you talk about, the role of psychedelics in this kind of context?
I'll just say that I have referred some patients who are so depressed that they can't engage in the rest of their care with long COVID. And so I have referred those patients, but not I have not been familiar with people using it just for long COVID overall.
So similar experience. Yeah, definitely have seen people respond very well with depression. It's hard to predict who's going to respond really well to it. And I hope there are some studies in long COVID. I hope that comes up.
That's great. And I saw, Dr. Grossman, you had mentioned on one of your slides about Tai Chi and Qigong, and I think there's been some literature on fibromyalgia, right? So I'm just curious as well. And also for our physical therapists, like if this has been, anecdotally, have you seen responses for patients with long COVID related? Is it pain or is it joint mobility? What is it that you're seeing that's responding to things like Tai Chi or Qigong?
So the Qigong for sure for pulmonary symptoms, breathing. I think just learning, doing a breath technique that's you're seeing someone else do and you're doing it with them helps some of the anxiety involved in not being able to breathe. But therapeutic yoga has been really helpful, and there's been several studies done that show help with anxiety, with pain, with the fatigue. I think calming the nervous system and bringing up that parasympathetic tone compared to the sympathetic drive. A lot of people describe this chronic living in a fight or flight state, and we know how bad that is for your health, every aspect of your health. So the therapeutic yoga really does focus on bringing up the parasympathetic tone. And so again, it's just like different modalities are good for different people. So some people will look at you like when you say yoga, like you're, losing your mind. And other people are like really excited about doing some yoga. And there's like Yoga with Adrienne is online. I don't want to give, I'm not paid. I'm not giving a plug for any one particular person, but there are some yoga programs online for long COVID. So it makes it easy to do at home.
Yeah, thank you. And actually, we have a website, Long COVID Care Reach, which is, this CME is part of that whole initiative, and we're part of a federal or national consortium, Long COVID Care Network, and we have colleagues around the country who are also creating resources. So we'd like to link to these on our website, and it'd be great if we can collate these. And so please do visit this. In the future, we'll be adding more resources. We also have patient facing in different languages, Spanish and Chinese as well, videos about brain fog, about sleep and pacing, etc. And we'd love to link to others as well. And I know Dr. Martin shared a resource about guided meditation. And then Dr. Lazarow, you have one too. If you feel free to speak to it, but I shared your YouTube link as well for mindfulness meditation. And these are great resources that are available.
Yeah, it is meditations. And then there's kind of just a whole free mindfulness course on there it's kind of specifically gauged towards people who are dealing with kind of medical issues or focus on the body. It kind of has a whole section like Dr. Grossman was mentioning on like a stress's effect on the body, fight, flight, and kind of shifting those things. So yeah, that's on there. It's all for free as a resource to send to any patients.
Great, thank you. And then for our physical therapy colleagues, so there was questions about, well, one is vagal nerve, I think vagal exercises, and if there's any resources for that. And two is, do you have any thoughts about chronotropic incompetence?
So I can speak to the vagus nerve exercises. So this was actually something that I went to an EDS course and found. It's the Rosenberg exercises specifically, and you can Google this. I did a quick check. Salamander exercises are the ones that we use the most. So the half salamander, they're all things that somebody can do in a span of 5 minutes. Which is usually what I have my patients do. That's their kind of radical rest, where they just take a minute, they do their salamander exercise, and then they're ready to go to the next activity.
Thank you. All right, and for Dr. Prestwood, as well as everybody on the panel, as well as our physical therapy colleagues, because both of you kind of mentioned this, and Dr. Grossman, you mentioned this as well in terms of fight or flight. I do see this, kind of underlying this theme of autonomic dysfunction and this hyperadrenergic or fight or flight sympathetic state. What are your thoughts in terms of like that as the underlying thing that we need to address that could manifest as anxiety or panic or insomnia or, of course, the cardiovascular type symptoms as well.
I'll just speak briefly from a physical therapy standpoint. I do specialize primarily in vestibular dysfunction, and I find that unless patients have access to the right objective testing, a lot of times those, very minor but still present symptoms can persist, and it's probably not the driving cause, right, for this, autonomic dysfunction, right, or the anxiety, but it can definitely add a layer to it. And it can become like a cyclical pattern because they're working all that much harder just to stay oriented and upright and focused and present. So again, that's not the main thing, but it's definitely, I've pushed a lot more for the objective testing with video oculography and collaborating pretty heavily with audiology as well.
Thanks, Dr. Prestwood.
I don't have a lot of insight to add, but just general appreciation for how complex the mechanisms of feedback are, even for very biologic things with lifestyle behaviors. It does change our biology. There's this interaction between it. We like to think of it as biologic and behavioral, but there's so much interface. So treating, like all the talks today, I think are focused on things that will both improve the underlying immunology parameters and improve lifestyle quality.
Yeah, that's really great. I like Dr. Lazarow, you were mentioning, sort of the stress to immune system and the kind of mind to body connection. And also there's the reverse too, right? Like the body to the mind. And it's just all interrelated and then in the context of the social interaction, the environment. So yeah, anyway, we kind of, as we all talk to our patients about multidisciplinary, but whole person health, and Dr. Grossman, as you mentioned, just thinking about the entire person and the context in which they live. So great, thank you. And I know we're close to time here, but and feel free for the whole panel if there's any last comments you'd like to make. I was just curious too for Dr. Prestwood, you were mentioning TMS for brain fog. Brain fog is such a huge issue in our patient population. Can you speak more about this? What's the rationale? Any results?
Yeah. I don't know of any specific trials and the results yet there, but at least with depression and anxiety, one of the, I don't know if you can call it side effects, but one of the things we tell people to expect is that they often have more clarity of thought as a side effect of the treatment. So in addition to expecting a relief of the depressive symptoms on a pretty predictable timeline, they also have like pretty quick responses in cognition and feeling like that's better. So it does seem like, whether it's treating the underlying problem or just kind of helping manage symptoms, I don't know, but it does seem like this also could be a promising treatment in long COVID.
Yeah, that's really fascinating. Thank you so much. And I know we're wrapping up our Q&A. There's many more questions that we didn't get to in the Q&A. So for our expert panelists, please, if you have a moment to just try to answer some of them, that would be great. And that way we could have the audience just read them along as well. And now I'll actually turn it over to a really privileged to introduce Dr. Andre Kumar, who has been leading one of the national efforts here at Stanford for NIH Recover Initiative, which is a really multi-pronged type of consortium trying to understand epidemiology, causes, and treatments for long COVID, and then future directions for where we're going as a field as well. And as a reminder, at the end, there will still be a poll, so please do stick around to answer that as well. Thank you.